Caveat emptor is the Latin word that means let the buyer beware. You buying all kinds of medications because you are having joint pain, you have to beware. You have to be careful because that is one of the major ways to worsen the joint pain. I've said it time without number that arthritis has no medications. There is no drug you take by mouth. There's nothing you take by mouth or rub on top of the joint that is going to treat the arthritis. The best they can do is to reduce the symptom. Every disease component has a symptom. Symptom is those things you feel as a result of the disease. It can be pain, it can be headache, it can be fever. Behind that symptom or those symptoms is the real disease. If you do not treat the real disease, those symptoms will continue to be there. Arthritis, for instance. Arthritis is the degeneration of the joint, progressive damage of the joint resulting in joint pain, joint swelling, difficulty to walk, and at the extreme, or when it becomes complicated, you have deformity of the joint. The first manifestation of arthritis is usually pain. Therefore, if I continuously take medications or any kind of treatment for the pain, what it means is that I'm treating the symptom and not the disease. Even if the symptom goes down, it will still come up again because the root cause, which is the disease or the arthritis is still there. Therefore, if I need to treat arthritis or stop the symptoms of arthritis, I need to treat the degeneration, which is the arthritis itself. By the time I treat arthritis, all the symptoms that it causes will disappear. It is important, not only arthritis, but any disease at all, to find the root cause of the symptoms and treat the disease properly, and the symptoms will disappear. If you want to get rid of arthritis, there are certain steps you need to take. I'm going to mention those steps, and you on your own will find out at which step you are, whether you're taking the right step or not. For any disease like arthritis, the most important thing is meet a doctor. Don't conclude on your own and make a diagnosis on your own and begin to treat by buying medications. Meet the doctor, especially a doctor that is specialized in that kind of condition. For arthritis, if you met the right doctor, he will send you for diagnostic imaging tests, which include X-ray, MRI, or CT scan. That is the second step. You have met the doctor, the first step. The second step is to run a test. There's no way you can be treating a condition without running a test. So when you have done these tests, X-ray, MRI, or CT scan, you bring the result back to the doctor. That's the third step. The doctor will look at the results and now make a diagnosis. The diagnosis will tell the doctor, yes, you have arthritis. That's one. Number two, at what level is your arthritis? With that, the doctor will be able to advise you. Having made the diagnosis of arthritis, if that doctor proceeds to giving you medications, it means that the doctor does not have any answer for you. If there's degeneration in your joint, which is arthritis, that degeneration has to be healed. You have to ask your doctor whether he has the treatment that can heal the degeneration. And the best treatment that can heal the degeneration is known as regenerative therapy. Components of it include PRP, prolozone, cold laser, or human stem cell therapy. If you don't have any of these treatments, any other treatment that's given to you is just palliative. Therefore, take these 4 steps if you want to get rid of the pain in your joint. And the earlier you take these 4 steps, the better. Arthritis responds very well to regenerative therapy if you could start it at early stages. Do not wait until no medications work before you begin to look for where to do regenerative therapy. has become a frontline treatment. Immediately you have pain, especially pain that have been there for more than 3 months. Go through these four steps I just mentioned, and you stand up to 70% chance of a complete cure of your joint pain. Thank you very much for your attention.